This is part of a webinar series. As you see, here we are in the managing pain today. Next week, we'll be talking about athletes. The Know Your Options is to be talking about the different routes of administration. How do you use cannabis? We'll be talking about improving sleep. And then for those of you in Florida, especially in the Central Florida area, we're doing an in-person seminar on November 16th in the Villages. We're actually going to be doing two seminars, one of them in the morning at 9:30 and one of them at 1:30 in the afternoon. So please join us. And then that night, we're going to be doing the terpenes webinar, the one that was canceled because of our friend Hurricane Ian coming to visit us. So we moved that for that particular date. But a couple of housekeeping issues. If you look down over here on your screen, you'll see a little Q&A button. Please use that for your questions. And we are here to answer your questions. There is no question that's a dumb question. I know that a lot of people have questions about cannabis, and we're here to answer them. We're not giving medical advice, but we are giving educational advice and direction and information about cannabis. So please feel free to use it. There is a chat button, but we mainly follow what's going on with the Q&A button. So Lisa, let's talk a little bit about pain. Pain is one of the most common patient conditions, not just for cannabis, but I think for doctors in general. I know talking to a number of physicians, they mentioned that pain is one of those issues that constantly comes up, and it's something that it's almost age independent. It doesn't make any difference how old you are, young or old. Pain is an issue that a lot of people have and they're trying to manage. And I know that a lot of people hear about something called chronic pain, which we'll define in a minute. And chronic pain is mainly misdiagnosed and mistreated, primarily because chronic pain comes from two or more sources. And our Western medicine wants to be able to find what the source is, and trying to find two at once is kind of hard. In fact, when I started doing these webinars 5 years ago, I had doctors that were telling me there was no such thing as chronic pain. I have chronic pain. So I would say, well, excuse me, but I think it's here. I think they've been able to find it. They've been able to diagnose it. And it's something that if you have it, you know you have it. So let's define what we're talking about with chronic pain, if you don't mind. Chronic pain is something that persists for an extended period of time. For example, for 3 months or more, and which occurs regularly. For example, I have herniated discs in my neck. It's something that is persistent. It has been with me since the accident, which was, I think, almost 6 years ago. And so it's something that isn't going to go away. I wish it would. But it's something that is there, and it's something that I have to manage on a daily basis. We hear about something called acute pain. So what's acute pain? Acute pain means that I have pain related to a specific injury or an illness, typically lasts for a month or two. And this happens to do with breaking your arm, spraining your ankle, banging your toe on a bedpost. Acute pain is something that does come and does go. But again, chronic pain and both acute pain are some of the top reasons that people look at doctors for help. And chronic pain is listed as one of the top reasons for long-term disability here in the United States. I know it's something that's really not a lot of fun. So how is cannabis, medical marijuana, and pain work together? Well, we know that cannabis has been shown clinically, and this is through trials and through tests, to be something that treats a number of different conditions. That could be not only chronic pain, but ALS, Parkinson's, epilepsy, MS, PTS. There's a number of different issues that really come into play here. A number of states allow medical cannabis for a number of different conditions. A lot of those conditions relate to pain, are pain related. But also, one of the things that's interesting is that with using medical cannabis, it's safe. One of the big problems with pain management, especially with a lot of the things that have been prescribed by VA, by doctors, has been the opioid crisis, where a lot of the remedies that were being put on the street were not only something that would attempt to relieve the pain, but would cause almost as many side effects that were negative than the pain itself: addiction, death, a number of different things. Just for your information, there's been no reported death from cannabis, either recreationally or medically, ever reported. And that comes from the CDC, who's been monitoring this for a number of years. And so it's something that is safe. Now, that doesn't mean it doesn't have side effects. It doesn't mean that you can't get high. It doesn't mean that you can't get anxious. And we'll talk about that during the seminar today, or webinar today, excuse me. But it's something that is safe. And that's what's important to understand, that you're not putting yourself in a position where it's going to be fatal. And it's something that a lot of patients turn to after they've exhausted all the conventional therapies. What I found amazing is that It almost is after it doesn't work with all the other remedies, they turn to medical cannabis and they go, God, I wish I'd have found that a lot later. I had one of my patients that tell me, why did it take me 78 years to figure out to start using this? I've been in pain for way too long. But I think it's something that really helps. And again, without the risks of the opioids and the different drugs that are out there. Now, how do we know it's safe? Well, there's a number of different studies and there's a number of different groups that have taken a look at it. One of them is US Pharmacist, which is the main clinical pharmacy group that a lot of doctors look at. And they actually look at number one reason for medical cannabis use was, in fact, pain management. What they found in a number of their studies that they did, and one of their studies was 62% of the patients were using medical cannabis for pain management, which I find that really, really interesting when you compare it to all the other alternatives that are out there. One of the main things that is important to understand is that a number of the traditional ways of treating cannabis, NSAIDs and that type of thing, they really do a number on your kidneys. They do a number on your liver. They actually can hurt you in many ways. Even Tylenol toxicity is something that can hurt a lot of people. You don't have that effect by using cannabis. And not only that, it also, when people have used medical cannabis, it's actually lowered their addiction to people that are using opioids. In other words, it is an exit drug for people that are using opioids, not an entrance drug. So it's something that's really, really interesting. And a lot of this has been backed up by studies. You'll see the studies that are listed here. It's something that you can kind of hang your hat on to know that there's a lot going on. Now, I will also say that when we talk about these studies, here in the United States, cannabis is considered to be a Schedule I drug. And that's a nice way of saying that it is deemed by the US government to have no medicinal value and is made illegal. Now, that being said, a couple of things come into play. First of all, the United States government has been funding research into medical cannabis since 1964. And I will say that one more time. We've been studying medical cannabis since 1964. We funded a gentleman named Raphael Mechoulam in Israel. And we basically built the entire Israeli cannabis industry. And one of the things that kind of gets me a little upset about that is that your tax money and my tax money has been used to fund medical cannabis and is being used today to fund research into medical cannabis in Israel. However, we, as the people who are paying for it, can't reap the benefits of that. So it's something that we should probably take up with, I'm not trying to be political, but with something we should take up with our politicians as to why we're paying for something that we're just not getting. Now, the other side of it is you can do anecdotal studies here in the United States, which means you can go out and look at patients who, for example, from the University of California, they found patients that had neuropathic pain. And what they found out is that cannabis being used in both low and high doses reduced the amount of neuropathic pain in a number of different patients. And that was very, very interesting. In other words, they found patients already using cannabis, went out and studied the effects of it, and found that it was very effective for neuropathic pain. They also found out, now in Canada, which is where cannabis is legal, they're able to actually do more significant studies than here in the United States. And again, McGill University, which is one of the top medical universities in North America, not to mention just in Canada, is also found that it significantly relieves not only pain, but also it helps with sleep quality, anxiety, and refractory pain with a lot of refractory pain, which conventional therapies have failed to be able to address. So there is research that is out there. And one of the fascinating studies that came out in 2019 was that they found it's very effective for both pain relief and insomnia. And 80% of the patients found that to be the case. That is amazing. When I talk to doctors about those studies, there isn't many studies done with normal pharma drugs that have an 80% rate of take. If they get better than 50%, they're happy. And 80% is something that's almost off the charts. So it's something that is very, very interesting and has been studied and in fact has been used in many cases for a number of different issues. Now I'm going to show here that these are the studies we have here in the United States. We have something called PubMed, and PubMed is where all the studies, research studies for any particular condition are put. So doctors can look at those studies to find out kind of what's new, find out what's coming, and also to be able to research what's the appropriate standard of care for a particular condition. Going back, you'll see that since 1999, studies have been put out there for medical cannabis and pain management. What's interesting is you'll say, wait a minute, something's wrong here. It's a Schedule I drug in the United States. How can these studies be done? Because all these studies are done outside of the United States. They're being done in Israel. They're being done in Spain. They're being done in Germany. They're being done in England. They're being done in Canada. And so there's a lot of studies. And what's interesting is when we started funding research into medical cannabis with Dr. Raphael Meshulam, we required all of his studies, or most of his studies, to be put in PubMed. And if you go to PubMed and you look up medical marijuana or medical marijuana and pain, you'll find there's a significant number of studies that are out there that have been put in there. They're available to doctors and basically to the public. I just find it really interesting when a lot of people and politicians say there's not been a lot of research. I kind of have them take a look at PubMed, and they're shocked to find the number of studies that are really out there. Unfortunately, they're not being done here in the United States. And I think that's something that I'd like to see remedied, because we could help thousands of people, if not millions of people, by being able to study medical cannabis here in the United States. Now, I would like to do something. I would like to play a video. Hopefully, this video will give you some insight. It's from Sanjay Gupta, and gives you kind of some insight into his thoughts on medical cannabis. So let's try this one.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive cannabis. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited The Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants and natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe, in part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas, more absorbent than cotton, and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
Fun fact, Mark, it's mentioned there that cannabis is, hemp is used to make canvas. The word canvas is actually derived from the word cannabis, because traditionally all canvas used to be made out of cannabis.
Oh, that's interesting. I didn't know that. That's a little tidbit that we should learn. I find it interesting that I think what that video is showing, and again, Sanjay Gupta is interesting in that when cannabis was first becoming popular, he was actually against it, and he was very vocal about that. And then he was challenged to study it, and when he studied it, he came back and said, "I was completely wrong. This is something that not only is beneficial, it's not dangerous." And he's now a big advocate of cannabis, and that's why he put out the weed programs. So it's something where education has really helped to be able to reverse that. It's there, but it really has shown that a lot of the decision behind making cannabis a Schedule I drug and making it illegal was not based on science. It was based on, candidly, politics. And had we followed the science, I think literally thousands, if not millions of people's lives would have been much better. But that's history, and let's talk about going forward. So when people say, what's the big deal about cannabis? Why would I want to take a look at it? Well, we all know about the nervous system. We've all heard about our nervous system since we were born. It coordinates everything that goes on in our body. At least I kind of look at this as our cell phone system of our body. If something goes on in one area, it tells the other area that there's a problem. And candidly, if something happens, it tells your brain, we've got a problem. You know, Houston, we have a problem. You have some sort of a pain, you have some sort of a gastric and digestive problems. It's something that's really there. What's interesting is they've known about the nervous system Western medicine has known about the nervous system for an awful long time. However, when our nervous system says, Houston, we have a problem, what does our body do with it? And this is what I found fascinating, that the Western medicine never really dug down into what they did with it until really 1940s. In the 1940s, they actually discovered the endocannabinoid system that parallels and works with the nervous system. Now, when it was discovered in the 1940s, because of the war, it wasn't studied very much. A lot of the work that was done during the war was actually to support wounds and medical conditions related to the war. It wasn't until we started funding research with Dr. Raphael Mechoulam that he took a look at why cannabis was effective, brought forward the endocannabinoid system, and found out this system, which parallels, actually works directly with the nervous system. So when the brain says, or your nervous system says, Houston, we have a problem in all these different areas that you see here, it actually goes in and it has a physiological process where it tries to help with pain, with anxiety, with memory, with appetite, inflammation, and your immune system responses. It's very, very interesting that it's been there and it's been working for an awful long time. And I find that to be kind of really, really interesting.
Yeah.
Lisa, your thoughts on that?
Well, we get questions a lot of the times is why can cannabis work with so many different things? And that's the reason, is because it's interacting directly with the system of your bodies. That's entire purpose is to make sure that balance is maintained. And so when something is out of whack, the endocannabinoid system steps in and tries to bring that balance back. And since cannabis interacts directly with it, that's why it can help with, those things that we mentioned before, pain and sleep and anxiety, which are things that we consistently see here at Insa patients coming in for. And so that's why a lot of people are surprised that cannabis can work for so many different things, but it does.
I tend to look at cannabis as what I call a whole plant, whole medicine cabinet. In other words, it has 450 medical properties. We know that there's 120 cannabinoids being studied. We know there's 100 terpenes being studied. These are all properties that are found inside of cannabis. Here are some of the cannabinoids, the most popular cannabinoids that are being studied. But the real big deal about cannabis is the cannabinoids working together enhance the healing efficacy of the actual product itself. We know that if we take a CBD cannabinoid and put it with a THC cannabinoid, it's almost like 1 and 1 is 3. Both of them have properties to help, for example, with pain or with inflammation, but working together, they're much more effective. That's the good news about cannabis. That's what the big deal is all about, is the entourage effect. That's also the bad news about cannabis, because Western medicine wants to study one drug, one route of administration, like a pill, and they want to see it only in one condition. And what's interesting is in this particular case, you have 2 or more conditions working together in the cannabis plant, 2 or more cannabinoids, and it can be taken almost 20 different ways to be able to produce the outcome that's out there. So it's interesting that studying it is very hard that's why there's not a lot, it's hard to do a lot of studies, although there are studies that have been done, but a lot of them talk about the cannabinoid combinations of cannabinoids rather than one or the other. Going back to what you were saying earlier, what we found in our body is our bodies produce endocannabinoids. And what those endocannabinoids do is they help put your body in a state called homeostasis. That's where you have balance in your body. So naturally, your bodies produce these endocannabinoids. You know that they're there. How does this relate to pain? Well, we know that the cannabis plant itself has something called phytocannabinoids. And phytocannabinoids, interestingly enough, what Raphael Mechoulam found out is that it's structurally identical to the endocannabinoids that we have. In other words, they mimic the endocannabinoids. If you're a senior citizen like myself, who doesn't produce as many endocannabinoids as I did when I was younger, having phytocannabinoids in my body helps my body to be able to do the job it needs to do to be able to keep myself in homeostasis. That's there. I think there's a lot of studies that's been done on this, and you can see this. So the real big deal is it's something that's natural. It's something that mimics exactly what's going on in your body, and it's something that's really safe. Now, let's get down into pain management. A lot of people talk about THC and CBD, the main active components that are in both marijuana and also in hemp. Lisa, you want to talk a little bit about this? Because I know CBD, which is found not only in hemp, but also found in marijuana, doesn't have a psychoactive effect, but it does have a big effect on inflammation And when you do reduce inflammation, that reduces pain. Is that right?
Absolutely. And so that's one thing that's really excellent about cannabis is that it really helps target the pain from almost two different angles. You know, you have your CBD that helps reduce inflammation, which is a major cause of a lot of people's pain. And then you have THC, which does have that psychoactive component, which can help block the pain signals from reaching our brain. And so not only do you have CBD that's sort of tackling the area of pain at its source, but you also have THC that's helping blocking the pain signals. It's almost like putting your phone on silent. Like, all right, I got the message. I understand that there's something going on, but I don't want to hear this message anymore. That's what THC does. And, the media often will try to talk about these different compounds as CBD is the medicinal molecule and THC is just the fun molecule that, just makes you feel elevated. But that is a really gross simplification. There's a lot of medicinal benefit that THC can provide, especially when paired with some CBD.
Sure. And also, but we've heard about Delta 9 and coming to cannabinoids, the Delta 9s and the Delta 8s. I know there's a kind of let's just say a trend right now. Everybody looks at Delta 8 as kind of the main cannabinoid to address pain, but really Delta 9 also is primarily the cannabinoid that really helps with that. But Delta 8 is primarily found in hemp here in the United States. And the reason that it's really, you find it a lot in the hemp shops is because it's really in low quantities found in marijuana. And a lot of the dispensaries like Insa will take those products and put them into other products that help with pain management, not just really trying to break an over-the-counter product that's really out there. But I know Delta 8 is effective, not as effective as Delta 9, but it's also not as psychotropic. It's not as psychoactive. It doesn't have as many of the milder effects with respect to the potential high that you can get that's out there. I know that some people, again, it depends on your person. Everybody's body is different. Some people's metabolism is different. Some people can have one drink and get drunk, and some people can drink the whole bottle and still be ready to go. With cannabis, it's kind of the same thing, but most people will find that THC, Delta 8 doesn't really have as much of a punch as Delta 9, but it is effective. I don't want to have people understand that it's not. And it is available in a lot of the products that you see out there. Now, what I also want to do is I also want to point out that there are other cannabinoids in our body that help us regulate pain in many, many, many ways. For example, if you take a look at the CBD, which addresses, I know that people talk about THC and CBD affecting the CB1 and CB2 receptors. CBD and THC affect other receptors other than CB1 and CB2, and these are the list of them right here. They regulate the bone function, for example, blood pressure. This one is very effective in things like inflammation. Also, it helps affect mood, nausea, vomiting, intestinal irregularities. Oops, what's going on here? I got a crazy guy here. You take a look at some of these receptors here, which are handled by CBC. It helps with body temperature. What does body temperature have to do with it? This is where pain and heat sensation comes from. And so it's very interesting to look at these receptors in your body that are being helped by cannabis and being able to put back into their normal and natural homeopathic homeostasis states. It's over here. And again, I go back to body temperature over here, which over here, and this is where you get a lot of the hypertension, hyperexcitivity, epilepsy, seizures, that type of thing. And then, of course, naturally, a lot of the THCV is what they call a protective. It protects those nerve cells, which makes it easier for, especially for neurological problems. It actually helps to reduce the inflammation and has a lot of anti-cancer properties that are in it. So this has to do with a lot of the products that are being sold. You'll find each of these cannabinoids that are out there. And again, working together, these don't outwork individually. They all work together to be able to provide the benefits to you.
Yeah, we like to say it Insa that the whole is greater than the sum of its parts. And so all of it working together creates a much stronger effect than them working in isolation.
Right. And there's been studies on each of these. We know this. This is not something that just came up out of the shelf. There's been a number of studies that are out there, and this contributes to that entourage effect. You want to tell us a little bit about the entourage effect, Lisa?
Yeah, absolutely. So, as I mentioned before, we like to say that the whole is greater than the sum of its parts. And some of those parts are the cannabinoids, the terpenes, the flavonoids. They're all created basically on the same part of the plant. And so when they're ingested all together, you get, much bigger, stronger effects. And one thing that's really nice about having a product that's fairly well-rounded is that if you have a product that, say, has a 1-to-1 ratio of CBD to THC, you're going to get the benefits of both of them, and it's going to negate some of the maybe negative, symptoms of each. And so CBD will help make THC feel a little bit less psychoactive, so you can remain a little bit more clear-headed. Terpenes are amazing. It's something that we really focus on at Insa, something that we really love to talk about with patients. And so the terpenes will provide those different special effects that the different cultivars or strains that you may already be familiar with have. And so terpenes are responsible for, one strain or cultivar giving you that energizing effect, and that one strain or cultivar giving you that sedative, relaxing effect, and everywhere in between. And when a terpene is present with a cannabinoid, you get another boost. And so, yeah, it's really amazing to see these components all working together to create a really strong effect for people who utilize cannabis.
Yeah. And one of the things I want to point out is that when you're taking a look at using cannabis, it's very important that you take a look at the products, and you can all products sold through dispensaries, at least here in Florida and a number of different states, will have to have on it the labeling. It's called the certificate of authenticity. And in that, you'll be able to see what's in the product itself. And you want to pay attention to not only the cannabinoids, but also the terpenes and the flavonoids. All of those working together, it's called whole plant. All those working together is what gives you the benefits of what's out there. And this is something that's very, very important to take a look at. Because again, the 1 and 1 is 3. You want to take advantage of that. And I know that's easy. We'll talk a little bit about how you can find out about what's in your products. But it's something that's really important to know what's there, and also to make sure that the terpenes and the flavonoids are there. The terpenes are the GPS of cannabis. They're what direct and brings the relief that you really need. It really isn't the strains, it's more the terpene profile than anything else. We'll talk a little bit about that as we go on. Let's talk about Delta-9. Let's talk about THC. It's been vilified in the press as, hey, you want to get high, here you go. Of course, it's been also positive. A lot of people that, recreationally want to use cannabis, this is it. I mean, this is they want to get a very high ratio of Delta-9. It's like 151 Bacardi kind of thing, get into a pool party type of thing. But really what we found is that THC has a number of characteristics. It works with the CB1 and CB2 receptors. It can produce psychoactive effects, but it also is extremely important at blocking pain signals in the brain. Now, I want to make that clear because this is a pain management webinar. I want to make that very, very clear. A lot of people say, I can take CBD and it gets rid of my pain. What CBD is doing is it's lessening the inflammation, which is reducing the pain, but it's not going to get rid of pain. If you really have serious pain, like I have herniated discs in my back, if you want to really have some fun, have a knee replacement, that's pain management at its finest. You'll realize that you need to have some THC that's there. And that's why getting your dosing correct, knowing where your therapeutic effective level is really important. If you get it right, it's amazing how well it works. I know that it's something that, like I said, I couldn't live on a daily basis without it. But it's something that I have also been working on and have been able to use for the last 6 years. But talk to me a little bit about some of the benefits of THC, not just for pain, but also a lot of these other areas do affect pain. I know when people have PTS, it will lead to pain.
Yeah, absolutely. There was actually a study that came out by Harvard a little over a year ago that said that THC can really help with chronic long-term pain better than CBD can. Mm-hmm. And so that's just another one of those, medicinal benefits that THC has. I know I mentioned at the top of the webinar that personally I use cannabis to help with my chronic nausea. And, CBD, if I have something with high CBD in it personally, it'll make me feel more relaxed about the fact that I'm feeling nauseated, but it's not going to cut through that nausea like a product with THC is going to. Right. And PTSD, not only does it help with the pain that can come with that, but THC, one of the benefits of it for people with that condition is that a lot of times they'll have traumatic nightmares, and THC can actually disrupt the REM cycle. And so it will prevent those traumatic nightmares from occurring, allowing someone with PTSD to have a more restful night's sleep. And
Sure.
so you can see the wide range of things that THC can actually help with. It's not just a good time molecule.
Yeah, that's there. It's fascinating to me because people will say to me, gee, Mark, will cannabis help me lose weight? And the answer is yes, it does. I know in my particular case, it has. And then, of course, I always get the question of diabetes. Will it help with diabetes? And the answer is yes. But again, this is where you have to have more than just a hemp-based product, which is 0.3% THC or less. You need to have more than that. You need a medical marijuana product to be able to do that. But it does help with that. I know it's something that my doctor and I have a number of discussions on this, but it's something that has been, I know there's studies that come out of England that have showed that how it really helps quite a bit with diabetes that's there. But I wouldn't vilify Delta 9. I would say look at it as something that really is important to help. It's all part of the whole combination that's out there. And as I mentioned earlier, both CBD and THC interact with the CB1 and the CB2 molecules. CB1 molecules are mainly found in the brain and in the central nervous system. CB2 molecules are mainly found in your immune system, the main part of your digestive system, your stomach, your body, your muscles. You find it that's there. CB2 molecules regulate inflammation and immune response, but really CB1 molecules are the ones that really help you with pain management. But the fascinating part that's come out the last couple of years is the effect that it has on other receptors in the body. And this is where medical science has really been shocked when they find out it's handling all of these other receptors. There are actually drugs that are being produced just to be able to address each of these one receptors by themselves, where if you use medical cannabis, you don't need to take 4 different drugs, for example. You can take cannabis and it affects them all. And that's what I find very, very interesting. So the more we're learning, especially when research has been done overseas, and a lot of this, like I mentioned, these research studies are coming not only out of Israel, but also out of Canada and out of England and also out of Spain, that are really showing that this is a very effective medicine that's out there. It is not a drug. It is a plant that acts as a medicine. It is not a foreign substance you're putting in your body because it mimics exactly the endocannabinoid system that you have. Now, we are on the precipice of a change. I know when I was going to college and as I grew up, all I heard about was indica and sativa. Indica was in the couch, meaning it would relax you. Sativa would make you energetic. We heard about that. And then all of a sudden, about 10 years ago, they started doing some research. And what they found out was all these different cannabinoids that were out there, but they also found out about these little things called terpenes. And terpenes actually are, like I mentioned, the GPS. They're the things that make that actually cause cannabis to be effective. I know I see one product that I've taken in the past. I took initially for pain management. It was 9 THC to 1 CBD. I used it during my operation to manage pain after my surgery. What was fascinating was that same product came out for sleep, to help you sleep. And what they did was they changed the terpene profile. And I started thinking that's very, very interesting. It wasn't the cannabinoid itself, or excuse me, the strain itself, it had this different cannabinoids. It was the terpenes. And by modifying the terpene profile, what it did is it gave me a different fingerprint as to what that particular product could do. And so what's interesting today is when you talk to people about cannabis, you'll hear a lot less about strains, and you're going to hear more about what they call cultivars. What is a cultivar? A cultivar is where they've taken a look at the cannabinoids and terpenes working together that give you the chemical fingerprint of what it's going to be doing. And I think we're on the precipice right now of where this is just starting to happen. But more importantly, I think in 10 years, you're going to be able to walk into a dispensary and say, give me something for pain itself. And I'll hone this right down. Give me something just for example, for arthritis. I think we're heading to something that we're beginning to home in on how these terpene and cannabinoid combinations really address different medical conditions. And you see that at Insa. I know you're doing a lot of work on terpenes, right?
We do. We're very terpene focused here at Insa. And, speaking to your GPS analogy, one way that we like to explain the differences between cannabinoids and terpenes is that, cannabinoids are the engine of the car and the terpenes are the driver. And so if you have a product with a strong amount of cannabinoids, it's going to be a really strong engine, get you where you're going really fast and efficiently. But it's the terpenes that are deciding, where are you going? Is this going to be an energetic, experience, or is it going to be like that sedative, sleepy experience like that you mentioned? And the different combinations of terpenes create these different profiles that really give these different cultivars or strains their different personalities. It's really what makes an indica, and what makes a sativa is those different balances of terpenes. And so that's why at Insa, we have the top 3 terps that are, or terpenes that are found in the product right on the can, because we want to make sure that you understand exactly what's inside of there from that terpene point of view.
Sure. And if you know the terpene profile that addresses your particular medical condition, it makes it a lot easier to figure out which product to use.
Absolutely.
And that's something that's there. And we'll be talking more about that over the next month or two in these webinars. But really what it also boils down to is, how do you find your sweet spot? What is your sweet spot? Your sweet spot is where you have it's the product that you take, it's the amount that you take that really puts you into based on your biology, based on your dosing and your consumption method, that really relieves and puts you into an area where you have your therapeutic efficacy of how this works. I know that when I had pain and I started doing dosing, where you go low and go slow, and as I was building up, when I started getting to that therapeutic point where I knew it really started working, my body told me that it worked. And that's really what's key. A lot of people will say, well, gee, Mark, should I use this or should I use that? Or can you recommend this and can you recommend that? Again, your body is so different. Every person's body is different. This isn't where you can say, take 2 pills and I'll see you in the morning. I mean, even in Western medicine, in pharma, which is based on weight, doctors still have a problem of doing prescribing, because patients either don't get relief or get negative side effects. Then they constantly have to adjust the formula. And what's nice about cannabis is you can do that yourself. But what's interesting is it really depends on you. Your body will tell you when you feel better. I mean, when I got to a point where my pain level really went down to a 1 as opposed to an 8 or a 9, I knew it. I didn't have to have a doctor tell me, and my body didn't have to have a doctor tell me. And that's what cannabis is all about, is you will know when it works. And if you take a little bit too much THC, you start getting anxious, you start getting, you may lose your balance, you may do a number of different things. So you know when you've gone too far. So you just basically back down, stay at that particular level, and that you're there. And I have a regime that I go through. We did a dosing webinar about 2 weeks ago, and we talked about, well, how do you dose? How do you find that therapeutic level? And if you can go to our website and go to Marijuana Aware, and then click on the follow-up button, and you'll be able to look at that webinar and be able to go through that. It'll help you be able to figure out what your sweet spot is. And again, I'm going to emphasize, listen to your body. The doctor's not going to be able to tell you, no third party is going to be able to tell you what's effective. You'll be able to know that. Now, that doesn't mean that they won't be able to help you find some directions in some areas that can be able to help you, but that's what's important. Now, how does this all work? What are we talking about? Well, we talked about your body having endocannabinoids. These are brain derived. Your nerves say, we have a problem. Houston, it's here. You're able to put into your body phytocannabinoids, which really go into your body, whether that's buds, tinctures, extracts, or whatever. I do want to mention that there are synthetic cannabinoids that are out there. These are produced by pharmaceutical labs. One of them is one called Miranol. This is a pure THC product, and I recommend only using it under the very close guidance of a doctor. Okay, it is effective, but it has a lot of negative side effects. So I don't want to talk about synthetic cannabinoids at all. I want to stay with natural plant products, but I want people to know that they're there. That's why I bring them up, that you're out there and you'll hear about them. But what they're doing, what's interesting is, if you take a look at what's going on, those endocannabinoids and phytocannabinoids are all working with the endocannabinoid system, again, to control your appetite, control your pain, sleep, your immune system, your mood, your memory. Specifically, what they're doing is, as you take those phytocannabinoids, they're stored in the fatty acids of your body. What's interesting is when you have your nervous system, neurons, Houston, we have a problem, your brain recognizes that. It converts those fatty acids to long-chain fatty acids, and they get distributed through your body, through the bloodstream, to that particular part of your body that needs help. That's why And many times people will, for example, I've had patients that have taken cannabis for their arthritis. And it has helped them with arthritis, but they'll come up and they'll say, you know, I've had this pain in my shoulder for, 15 years, and all of a sudden the pain in my shoulder went away. Or I've had trouble just sleeping through the night. One of my good friends really hadn't had a good night's sleep in over 20 years. And he was taking it because he had a problem with arthritis. And he came back to me and said, I know it's helped me with my arthritis. He was a mechanic, which was hard for him to grip the tools and things. But he said, what's really helped me more than that is, he said, I'm getting a good night's sleep. I hadn't had 8 hours of sleep in 20 years. And he said, I feel so much better because of that. And that's really what you're talking about. Lisa, you have any comments on that?
Yeah, well, we've heard a lot of those stories as well. And one way we describe this is that you want to think of, when you're thinking of the receptors and the cannabinoids, you want to think of a lock and a key. So the receptors are like a lock on the door to your body's functions, to do all those things, to reduce pain, to help you sleep, all of those things. And the cannabinoids, they're the key. And so once they connect, that door opens and your body is able to do all of these wonderful things for itself.
Sure. Now, let's go back and let's talk about products let's home in on what products you should be using if you're trying to manage pain. One of the ones that come up naturally is Delta 8. So let's address that in the middle of the room. Let's address it head on. What is Delta 8? Delta 8 is basically, it's almost identical as far as its molecular structure, but it's just a little bit different. And that little bit of a difference really causes it to be about 50% as effective, but also 50% as psychoactive. And that's why, but it's also found very heavily and found a lot more in hemp than it is found in cannabis itself over here. And it's something that is out on the market. A lot of head shops and a lot of CBD shops sell it. And it's something that is there, and it is effective. It does work, but not as well as Delta 9, especially if you're trying to manage pain. It may help somewhat, but really you really have to understand where your pain's coming from and what's going on. These are the benefits of Delta 8. And these are what we see. Almost all cannabinoids in your body have some sort of a benefit. And I don't want to vilify Delta 8 as a bad cannabinoid. There's no such thing as a bad cannabinoid. They're all good. And this is what Delta 8 will do for you. Okay. And it's something that will help you quite a bit. What I do want to do is make you aware of the fact that because it's coming from hemp products, in many cases, it's not regulated. It's over here. And so what's interesting is when the Farm Act made hemp products legal, a lot of folks started making Delta 8, but it wasn't really something that was being regulated. And that's what I think is important. Check the COA, Certificate of Authenticity. Here's one over here for a Delta 8 product, okay? Anybody you buy Delta 8 from should be able to point you to and be able to get for you a COA. When I did a webinar about a year ago on just Delta 8 by itself. I went to 5 stores around me that sold Delta 8. Only one of them had a COA. And that COA was, and that particular retailer had an authentic product. The other 4 did not. In fact, when I went back and checked out those products, what was in the bottle and what was on the label didn't match. That's what I think you have to be careful of. And we've heard about cartridges not being legal because they weren't state regulated. Just be careful. That's all. My main concern for the public is just be careful when you look at Delta 8 products. Make sure the COA is there. Every shop will tell you, oh, I have a safe product. Yeah, it's been tested. And if they say, yeah, it's been tested, then say, show me the beef, show me what's there. I think that's really, really important. And that's what the U.S. Cannabis Council is saying. Just make sure that what you're getting is exactly what you think you're getting that's out there. Here in Florida, dispensaries are highly regulated, meaning their products are tested twice by the dispensary and once by an outside third-party firm. So you know that you're getting a product that's safe, not necessarily something when you go into a store. Although I do have to admit, Nikki Freed did a great job of making sure that all of the products that were sold in the CBD stores did in fact match that. That's the good news. The bad news is that certain people and I'm not being political, DeSantis took the funding away from her to be able to actually go out in the field and be able to test that. And so I think that's something, unfortunately, wasn't good for the public. But I know that the efforts are being made, at least at the state level, by some individuals to be able to make it safe for us. Now, we talked about terpenes, and you talk about pain management. Terpenes are very, very important. You talked about the big three. I kind of talk about the big six. Tell me a little bit about terpenes, because really what you're looking for when you go into a dispensary, when you're looking for a product, and I know Anonymous and Robert, you ask questions. And by the way, if anybody else has questions, please ask. Again, there's no such thing as a dumb or a bad question. Please bring them up. That's what we're here for. We'll talk a little about, we'll address your questions directly, but a lot of it relates to the terpene profiles. So tell me about your big three, for example.
Yeah, so, the big three for pain relief, as we like to say, is going to be your pinene, your myrcene, and your caryophyllene, also pronounced caryophyllene. And those are often called the big three because they have the strongest effect at mitigating pain.
Mhm.
And so, products that are really high in those three are going to be a really great place for people to start if they're experiencing pain and chronic pain. Now, I do want to say, though, that if you, was that?
Go ahead.
Oh, sorry. I do want to say, though, that you really want to take stock of, products that are effective for you, and because everyone has a unique system. And so just because those are the big three that really help a lot of people with their pain doesn't mean that you may find that linalool is actually the terpene that's really targeting your pain. So keep stock of that. If you find something that works, write it down in a journal, write down some notes, put a note inside your phone. And then look for more products that have those characteristics when you go into the dispensary. And a bud tender or a retail associate should definitely be able to help you find them.
Sure. Now, I tend to also warn people, especially that have PTS, be careful of pinene. And the reason is that the good news and the bad news about pinene is it helps bring back memory. The bad news is a lot of people with PTS don't want to do that. Okay, so I would say if you're suffering from PTS, really don't head down the pinene path. Stick with myrcene, stick with caryophyllene. I do know that I've talked to a number of doctors recently who really recommend, for example, limonene and linalool to help with pain management as well. And I know another terpene, although it's not a primary, it's not in a lot of products, but is very effective, is eucalyptol. Eucalyptol is very, very effective for pain management. It's an analgesic and also helps with anti-inflammatory. But it's not as popular as you'll find in a lot of strains that's out there. Caryophyllene you'll find in almost all products, same thing with myrcene. And so that's why they call them the big three. There's primary and secondary terpenes. But these are the terpenes that you want to look for if you're trying to manage pain management. It's better to walk into a dispensary and say, I'm looking for a product with myrcene and caryophyllene or pinene than it is to walk in and say, I want a strain. Because what you really need is that terpene profile to really provide the relief that you need. And what they'll do is they'll match the strain that has those terpenes in it to give you the products that you really need that's out there.
Absolutely.
It's there. Now, what product should you look for? Well, if you go out and you do research, you look at Leafly, you look at a number of different folks, they'll give you the strains, the terpenes, and there's different profiles that are out here that you'll see that are there that really help you with a lot of different products. One of the things that's going to happen after this webinar is you'll get an email, and that email will have a copy or a link to a YouTube version of this video. It'll have a copy of these slides, so you'll be able to get this in a flipbook format. So you don't need to necessarily write a lot of these down. You'll be able to look at that, and then you'll also get all the resources that we're going to be using, and then all the contact information for all the different groups like Insa. But these are the terpenes that can really help you with pain management. If you go to Insa yourself, tell me about the strains that you have.
Yeah,
and what I love is you got your little limonene in here in Mac 1.
Yeah, well, that's my favorite terpene personally. Really helps me out. It really helps with my chronic nausea for sure. And I just love the taste as well. So Mac 1, GMO, and Zookies and Runts, RNTZ. Those are some of our more popular cultivars or strains that help people with pain. And if you notice their terpenes, their primary terpenes, a lot of them are one of the big three that we just mentioned that are, considered very effective for pain relief. And not only do they really help with pain relief, but they have some other benefits as well. I'll point out Mac 1 because that's a really popular one for both patients and team members, honestly, because not only does it have the pain relieving benefit, but also can give you a bit of a mood boost. And so potentially really good for the daytime. because it's not enough to say, we don't want to be in pain anymore, because that's kind of a given. You also want to take into account, what are you wanting to accomplish? Are you not wanting to be in pain and going out during the day, or are you not wanting to be in pain and sitting at home, relaxing and watching a movie? And so these are things that we train our bartenders to, ask you when you're coming in and looking for those different terpene profiles. And so these are some that you're definitely going to find at our Insa dispensaries in Florida. And if you need something very strong, I really got to recommend the GMO. That one has a big punch, not only of THC, but it tends to be really high in terpene content as well. And so, this just is a sample. We have over 30 different cultivars and strains available for people to choose from.
Good. Yeah, this is good. It's a good lead that's there, and we'll be talking more about it. But let's talk about one of the other things that I find very interesting is, how do you take it? Okay, how does it work? And these are what we call routes of administration that are here. We have a webinar on how to use it coming up in a couple of weeks. Let's start with inhalation. That's the most popular, because what's interesting is people say, well, gee, I'll just smoke a joint. I'll just take that bud, I'll roll it up, take it, and it'll solve the problem. It'll take care of everything. Now, the interesting thing about inhalation, which is great, is it works immediately, and it'll work for between 2 to 6 hours. And I say that because part of my regime, literally when I wake up in the morning, I have a vape pen, and the first thing I grab is my vape pen, and I'll take 1 to 2 hits off of the vape pen. And the reason for that is because with herniated discs in my back, especially having to sleep, there are some mornings I'll wake up in a level of pain of maybe a 7 or an 8. And I don't want to be able to stay at that level. When I first started using medical cannabis, and I was advised to try a vape pen in the morning, and I got up and I tried it, the pain literally went away within 2 minutes. It was almost like somebody took the pain in my back, in my neck, and just wiped it away. And I remember the first time it happened, I said to my wife, but what is happening? This is just absolutely crazy. And I have to tell you, 6 years later, this morning, when I did it, it's something that is, how should I say, surprising to me, how fast it really works. Now, let's talk about lighting up a bud. I know people say, well, I just got to get some flour, roll it into a nice blunt, smoke it. What's happening? What's fascinating about rolling a joint, I know that a number of my folks that I work with, especially the veterans, there's a therapeutic value in rolling that joint, and they really love it. And I think that's great. But when you take that joint and you take that flame that's 500 degrees or more, and you put it to the end of that joint, you burn off half of the cannabinoids, all of the terpenes, and all of the flavonoids that are in that particular product. You've taken the efficacy, medical efficacy of that product from 100% down to probably 40% of what it could do. Now, that being said, it's still effective. It still works. It's still a very effective way of working without necessarily having all the terpenes and without necessarily having all the flavonoids that are there. That's what's amazing about cannabis, is how well it works. But it would be much easier to be able to use something like a vape pen or a concentrate, which keeps the flavonoids and keeps the terpenes in the product, being able to use that rather than trying to roll a joint. Lisa, you got some comments on that?
Well, I can't roll a joint to save my life. And so, and I've tried. And so that's one reason why I love the vaporizers as well. And they tend to have a really high concentration of terpenes. And so if you find a specific terpene profile is, really affecting you positively, those vape cartridges are really going to be something special. And since they are so strong, since they are a concentrated product and can have more than double, sometimes even triple the amount of cannabinoids inside of there, you're really only going to need 1 puff, maybe 2, as opposed to smoking a whole joint. And so you're going to be able to medicate and get on with your day nice and quickly, as opposed to, having to wait to smoke that entire joint. Not to mention they smell a whole lot less. And so you can be a little bit more discreet with your vaporizers than you can with a joint.
But also, when you use a concentrate or a vape pen, some vape pens, this one you have here, you can't control the temperature level. It comes with a set temperature level. And I think that's somewhere around 380 or 390 degrees. Is that correct?
Yeah, it might be a little bit cooler than that, but it is around that temperature.
Yeah.
Yeah,
But a lot of the, I know the vape pens that I use and for concentrates especially, and for cannabis itself, I actually have I have a device that I use to actually use for flower. I can control the temperature. So I can put the flower in this. I can actually set it to, in my case, the preferred temperature I like is 360 degrees. And I'll show you why in a slide in a couple of minutes. It gives me the maximum number of terpenes and cannabinoids that I need for my particular condition. But by being able to use a lot of these vape pens, you're able to control the temperature, which really helps you be able to home in on and be able to be able to keep the terpenes and the flavonoids in the product. I know your Dart product has 3 temperature settings, and a lot of vape pens have temperature settings, right?
Yes. Yeah. And so if you want to get a vape cartridge, one of those 510 threaded ones that you see in the center there, you can get ones that have different, temperature settings. And our Dart Pod battery definitely has those 3 temperature settings, low, medium, and high.
Sure.
And so if you want to have a lower temp one, so you can maintain a lot of terpenes, maybe have a little bit of a better flavor on the draw, then that's going to be a really great option. But if you just need a really big draw with a lot of cannabinoids going into your system, then you can crank it up all the way as well. And so we give you the option with that battery.
Sure. But it allows you to tune in. Again, what you're doing is
Exactly.
you're trying to tune it to what's there. I'm not against smoking flower in a joint. Trust me,
No.
I'm not against that. It will bring medical relief. What I don't want you to do is waste a lot of money on burning up a lot of product and give you a lot more benefit. And that's why I personally prefer to either use, if I use flower, I have a device that controls the temperature and or the concentrates that use the temperature. Because for me, I really use it to be able to, well, relax. There's no question about that, but also to be able to control the pain. And that's something that's really, really important. So inhalation is something that's really there. We'll talk about temperatures and products later, but if you visit a dispensary and you get a vape pen, I recommend getting a pen that you can control the temperature, because it'll help you better chance to get in the relief that you're looking for. Let's look at another option, which is sublingual, which is the way most people start to use medical cannabis. They'll put it under their tongue, they'll swish it around their mouth, use the blood vessels. And what's interesting about this is the blood vessels in your mouth and under your tongue absorb the cannabis, and literally within 15 to 30 minutes, it'll work for 4 to 6 hours. In my particular case, I take my vape pen, I take a hit, literally it's on my nightstand when I get up in the morning, and right next to it is the sublingual drops that I use. And I use them because after about right immediately I get the pain relief, but after about 20 minutes, the sublingual drops will start kicking in, and I know that'll last for the rest of the morning, if in fact into early afternoon. And that's really what it's all about. You may kind of mix it. I have a regime where I kind of do a little mix and matching that you see over here. And this is where the tinctures come into play, both tinctures and also sprays, products that are out there. And you hear about ratios. In this particular case, you'll hear about 20 to 1, 5 to 1, 4 to 1, 1 to 1. The most popular way to start is a 1 to 1, 1 CBD and 1 THC. That's what that means. The first one is CBD and the second one is THC. My wife, for example, uses a 9 to 1 because she found that using 9 CBD to 1 THC is best for her. She's very sensitive to THC, but it really helps her quite a bit. And there's a difference between when she takes it and when she doesn't take it, from the standpoint of her mood, her pain management, and just to say overall the well-being of her particular body. It's helped quite a bit. That's there. You have a number of tincture products at Insa, right?
Yes, we do. We have a really good range of them. We have 1 to 1, 2 to 1, 10 to 1, and even 20 to 1. And so we have a good range of them, because and pure THC as well.
Yeah.
If you don't want any CBD in there. And what's nice about tinctures as well is not only can you drop them underneath your tongue and get that, more immediate relief. If you want a little bit of a slower onset with the longer lasting relief that you would get from a traditional edible, you can use a tincture to infuse a food, like a smoothie, a salad dressing, or something like that. So they're a very versatile product to be used for sure.
A lot of people put them in their coffee.
Put them in their what? Coffee?
They put them in their coffee.
Yeah.
To do that.
Yeah.
Now let's talk, before we get into oral products, I love to talk about gummies and things like that. Let's talk about topicals for a second, because I know that you are currently you have a product which is getting approval from here in the state of Florida. As I mentioned earlier, all products have to be vetted by the state of Florida and get approved, and you're in the process of doing that. So in the next couple of weeks, this will be on your shelf. But I think it's important to note that it's going to be there. But topical products work very well, especially transdermal, the ones that go immediately into your bloodstream. And I know that that's something that works almost immediately. Now, when it says 2 to 72 hours, that's a little misleading. There are some transdermal patches that'll work for 72 hours. It's not that the product works for 72 hours. Most transdermal patches work between 2 to 8 hours. But there are some here in Florida that work up to 72 hours. But really, it works very well. I know that I use this quite a bit on my neck, which helps me quite a bit. And then also on my knees. Okay, I'm one of those crazy seniors that decided I'm going to get healthy, and I got into a martial art. And I do 3 times a week. I go to the temple for some work, and I'll definitely feel it afterwards. Let's put it that way. I'm not a 20-year-old, but I can tell you the health benefits. The reason I do it, the health benefits are just amazing. But tell me a little bit about your topical.
Yeah, well, we have lotions and salves at Insa. You know, we don't have any transdermal patches yet, but it is something we're looking into maybe carrying in the future. But I love telling the story about topicals is when you have it in a lotion, it does not penetrate the lipid layer of your skin, and so it doesn't get into your bloodstream. And what that really means is that you can have a lotion or a salve that has high amounts of THC, and it will not get you high. And so one reason why I love topicals is because close to home, it actually really helped my mother. So she also had knee surgery, much like you, Mark, and she was in some considerable pain. And I was like, Mom, you got to try our lotion, our 1-to-1 lotion. It's amazing. We've gotten some really wonderful feedback on its ability to reduce pain. But my mom hates all intoxicants. You know, she'll have like 1 pina colada every 8 years, and that is it. That's her limit. And so I brought home some lotion. I popped it on her knee. And, you know, within like 10 minutes, she's looking down, she's rotating her ankle, and she's just got this look on her face of like, wow, really? This is really working for me? Is this placebo? Is this in my head? And since then, you know, I make sure she's always stocked up with that lotion because it helps her, you know, when her knees are aching, when she has arthritis, when she has swollen joints. And so that's one reason why I love our topicals, is because they're able to give you those pain relieving and inflammation relieving benefits of THC and CBD without the high. And so even the most wary users are able to get substantial relief from those lotions and salves that we carry.
Sure. Now, the one that I love talking about is oral products. This is where your capsules and, more importantly, your edibles come into play. Really, really important to understand. When you have an edible, you eat it, it goes into your stomach. It takes anywhere between 30 minutes to 2 hours for it to get absorbed into your system. And what it does is it converts from delta 9, for example, to delta 11, hydroxy delta 11, which is actually more effective in pain relief than just delta 9 by itself. Very, very effective. However, it takes some time. And a lot of people, there are famous stories, and my mother is one of them, who you tell her, we're going to try an edible, because my mother was diagnosed with breast cancer, and she had some pain. So we said, try this particular product, take a little bit, try it. We got her a chocolate because she's a chocoholic like me. Guess where I got it from? And so we said, take this little piece, this little corner, try it, and then in 2 hours, tell me how things are going. Well, my Portuguese Italian mother, who has the patience of a gnat, waited about 10 minutes and it didn't work. So guess what? She tries another one. And guess what? And that didn't work. After about 20 minutes, she takes some more. She then called me after about an hour and said, Mark, I'm feeling great, but I don't know what's going on. I had my brother come over and find out what's going on, because he lives in California. I live in Florida. And he comes in, and she had eaten half the candy bar. And my brother calls me and says, Mom's baked. I mean, we have a saying in this industry, about the time you think it's not working is about the time it will start working. And I have to caution everybody with edibles, don't go popping a bunch of edibles, okay? They work, and they're extremely effective, and they have a very long duration. But as we say, be cool, baby. Have patience and let it take. I use edibles. What I use it for is, you notice this 4 to 10 hour. just before, about an hour before I go to bed, I grab I have a little chocolate. And I try that. And by the way, I compliment Insa on some great chocolate bars, by the way. My
Yeah.
compliments on you.
They're amazing.
Yeah. And I take a little bit of that and literally it takes about an hour for it to work. But I sleep like a baby all night. And it really helps. In fact, if I don't do that, sometimes it's really hard for me to sleep in general. So be cool with edibles, and that's both capsules and also edibles by itself. Any comments you got on that, Lisa?
Well, I would say we have a saying in our industry, start low, go slow. So if you're new to edibles, start with the lowest amount of servings that you can. That's typically 1 5 milligram serving. In the case of Insa chocolate, that's one little triangle, and then go slow. So wait that full 2 hours before you have more, because you can always have another piece of chocolate, but you can't undo one. So you want to be really careful there. And yeah, our chocolates are phenomenal. I can't say enough.
You actually have a chef who makes them, right?
Yes, Julian Rose. He is a master chocolatier. He's been a chocolatier for over 40 years.
Yeah.
And in some publications, he was considered one of the best chocolatiers in the nation. And that's just chocolate. That's not, infused chocolate. That's just chocolate in general. And so we're so lucky to have him on our team and to formulate some of the best chocolate bars that you can find.
Well, listen, let's get to a number of the questions. This is a chart. I'm just putting it up. It's very busy, but you'll get it in your packet. It talks about the form. It talks about how long it takes to work. It talks about how long it actually works and some notes on that. We provide that to you because it'll help you be able to really choose the products that are there. And my comment was, if you haven't noticed, I'm very big on inhalation. I'm very big on sublingual drops. Love the edibles. Love the topicals. I do use transdermal patches. And then also flour and concentrate. So you can mix and match these things that are out there. But when I talked about temperature earlier, when I use the vape products, this is the heat range over here. And when you heat it to, for example, like I mentioned, 360, it triggers these cannabinoids, and these cannabinoids are actually produced, and these terpenes. And if you notice, these are a lot of the caryophyllines, for example, that are here, the linalols. Those are all very, very important to be able to help me with my pain management that's out there. So I recommend really a medium setting on a vape pen. If you get a vape pen and you can set that, I know if you buy one off the shelf and it doesn't have a setting, you're really in this range in here, kind of at the higher end of this range, but this is where you're looking at it in this particular case. This is why we talk about the different temperature ranges that are over here, that are there. Okay. Now, let's dig into some questions. And I know we have thank you very much for a lot of questions. Let's kind of take them maybe in order as they came, if you just don't mind. One of them says, hello, can you recommend the most effective CBD to THC in the form of tincture oils and also vape cartridges for the purposes of reducing inflammation, decreasing chronic pain, as well as bilateral lower extremity peripheral neuropathic pain? You are talking about a lot of what I have, which is pain in the neck, literally. So again, I'm going to go back to what I said earlier. There is no take 2 pills and see you in the morning. Your body will tell you what works, what doesn't work. I recommend starting with a 1-to-1 CBD to THC ratio. And I know that you're saying that THC is very effective for pain, and it is. But really find out how tolerant you are to CBD. Once you know if you are sensitive to THC or not sensitive to THC, then you can start getting into the different ratios that are out there. So what I tend to use, for example, when I'm trying to use for my pain, and I'm talking about myself, okay, I use a product that's 1-to-4, 1 CBD to 4 THC when I really have to go after and manage my pain. And I typically will do that more in the evenings, so I don't have to worry about any effects that I would have with the THC. I typically will start, ironically, when I had my knee operation, I think I was mentioning that I was using a 9-to-1 product. One night I ran out of it and I was in pain. And of course, dispensary wasn't open. So I used a high CBD product just to see what that would do. And fascinatingly enough, my pain started going away. In fact, it almost was as effective as using THC. And when I went and talked to some medical marijuana doctors and some researchers, it was very clear that my problem with my knee surgery was inflammation. And from that if I could reduce the inflammation, it reduced the pain. And it was like a aha moment where I said, if I can reduce the inflammation. So a lot of what I use, one of my most effective products I use on a regular basis is a 2-to-1, 2 CBD to 1 THC. I found that to be very, very effective. In fact, lately, the last couple of months, I've been using 2-to-1s as almost my go-to products because I found them, especially during the day, I don't have to worry about really being high. I do seminars and I help patients on a daily basis. It helps me be able to function. So I would say, look at something find out where your therapeutic level is, how much tolerant you are to THC. But I would say, look for something that's a 2-to-1. Now, I would also take a look at, and again, I have chronic pain because I have pain not only in my neck, I have herniated discs in my back, and I have 2 artificial knees. So welcome to being a senior citizen. So I have pain in a number of different areas that are there. I would also take a look at, I look at a vape product, and I'd mainly look at a concentrate. There's a number of concentrates that are out there. Go into your dispensary. Tell them you're looking for a product, as we mentioned, for the big 3, especially with myrcene and beta-caryophyllene and pinene. Talk about a product. Ask your bud tender, ask the person behind the counter for a product that has that particular profile, especially in the case of beta-caryophyllene and myrcene and pinene. They'll be able to guide you to the products that are there. There are a number of concentrates that, what I love about concentrates is they are in the product. Now, be careful when they say, I have this flower that has it in there, because unless you have a device that can control the temperature, you're going to burn off those terpenes, which you don't want to do. Okay, but I'd say take a look at a concentrate that's out there or a vape pen that has that particular profile. Your thoughts on that, Lisa?
I completely agree. We have a 1-to-1 vaporizer that is incredibly popular with people who are looking to help lower their pain and inflammation. Mm-hmm. And I personally really like to use it not only for, pain, but also for anxiety. It's really good to help lessen, the effects of anxiety as well. And sure. So, the Northern Lights 1-to-1 vaporizer at Insa is definitely going to be a really great option for you sure. to try out. And then, like Marc said, take stock. See how that affects you. If you find that there's a little bit too much of a high, then go to a 2-to-1. If you find that maybe it's not doing quite enough, maybe try something that has a little bit more THC. Cannabis, use is a journey. You're not necessarily going to find the absolute perfect product the first time, but there are a lot of options out there, a lot of different ways to use it, and a lot of different ratios for you to try.
So I hope that answered that question. Robert asked a great question. In general, what would work better to help with chronic pain and lower back pain, THC that is inhaled or tincture drops? Well, let me go back, Robert, and mention yes, THC will help. There's no question. And you have to have a certain amount of THC. But I would also say, don't pay attention to having some CBD in there, because that CBD THC combination, 1 and 1 is 3, will help you quite a bit. Now, when you ask me what works better, it's not a matter of works better. I use both. I mean, the reason I use the inhalation product is because it works immediately. I wanted to be able to get rid of it right now. I have been in situations where I've had to speak, where I've all of a sudden had some pain. And so by being able to use an inhalation product, I'm going to be able to do that without pain, which is better than trying to speak with pain. I know that in certain cases, it's been able to work very effectively. The tincture drops will start working after, in my case, 20 minutes, let's say 15 minutes to 30 minutes, but will last for between 2 to 4 hours. So I would say both. I wouldn't choose one over the other. In fact, Robert, I think in your regime, try starting out with a vape pen that will be able to address your particular situation. Make sure you have the right combination of terpenes in there, and then augment that. Take that at the same time with a tincture drop. And what you're going to find is it works wonderfully. I know I do that. I unfortunately, as I mentioned, I wish my herniated discs would go away, but I do something in the morning. I do something right after lunch in the middle of the afternoon, and I do something in the evenings, and then I do something to sleep, because that's what I need to do to be able to keep down the pain in my body. And I've also found that by being able to use this over the years, it's been able to lower the amount of inflammation in my body, which makes it a lot easier for me to be able to manage it than it was really even 5 years ago that's out there. So really, it's something to really take a look at. One other tip I'll give you, Robert, is about every 4 to 6 weeks, I will take a holiday. I'll stop using cannabis, in my case, for about a day and a half. Now, if you talk to a lot of cannabis practitioners like myself, what they'll tell you is you should really try to take about 4 days off. And what are you doing? What you're doing is your body is used to producing endocannabinoids. When you're bringing phytocannabinoids in there, your body can get lazy. It can not produce as many endocannabinoids. It says, hey, don't worry, they're coming, they'll take care of it. And your body gets very lazy and it doesn't start doing the work it should do. By not putting the phytocannabinoids in your body, it kind of wakes up and says, buddy, you can't sit on the couch. You got to do your job. That's what you're here for. And it causes things to work better. It causes the cannabis to be more effective. I don't have to take as much of it to get the relief I'm looking for. Now, why do I only go a day and a half? Because with 7 herniated discs in my neck, after about a day, they tap me on the shoulder and say, buddy, if you don't do something pretty quick, you're going to get nowhere here. I can't go 4 days. I can tell you that right now. If I had to go somewhere where I had to go 4 days, I would be in a lot of pain, which is something that I just don't want to do for a whole number of different reasons. And I'd be in a lot of pain. So it depends on your body. It depends on what's good for you. But I would say, Robert, try it. Do the regime with a vape pen and a tincture. And then about every 6 to 8 weeks, take a day off, take a day and a half off, take 2 days off, depending on your pain level, and you'll find it more effective after that. I hope that helps. Cynthia had a great question. Said, are there terpenes available in a source that you don't have to smoke? And the answer is absolutely. In fact, as I mentioned, a lot of times when you smoke it, especially blunts, you're burning off the terpenes. In fact, almost all of the other forms of administration, meaning your tincture drops, a lot of your concentrates, a lot of your lotions, all have terpenes in them. And again, you can ask for the terpene profile that's really out there. Be careful with the number of edibles, because it's very popular for a number of folks to make edibles that have no terpenes in them. Okay, very high on THC, which is okay. I mean, if people want to just take a gummy and chill out for the night, bon appetit. But I think in my particular case, when I'm looking for medical relief, I want to make sure that there's terpenes in the edibles that I use. Then you can find that out with what's there. I know your chocolates have a number of terpenes in them. Is that correct?
Yeah, we do have some that do. Most of them are just a basic THC infusion and THC and CBD. But you're going to want to look for a product that is a full spectrum oil when it comes to an edible. It's often abbreviated as FSO. And so that's going to be the type of edible with terpenes that you're going to want to look for. Or even an RSO, which I will just caution you that, edibles are very strong, but RSO is very, very strong. And so definitely take it very slow with an RSO product.
Very strong, but very effective. Okay. Yes. It's like 151 Bacardi. Works great. Be careful. Okay.
You only need one.
Yeah, that's for sure. I had another anonymous question. I'm going to go about the location. We'll answer it in a few minutes when we talk about Insa. We had a question. Is there an app or a form for journaling that you can use? The answer is absolutely. We're going to give you a link to something called a patient information brochure, a PIB. And that patient information brochure has in it a form that you can use for journaling. And that's going to be in a flip book format that you'll get as an email follow-up to this. You want to look at page 17 and page 18 of the patient information brochure. It'll be there. But the answer is yes, we do have a form for that, and you'll be getting it as a follow-up to this particular webinar. And if you have any questions about it, send me an email at event@marijuanaaware.com, and I'll be more than happy to walk you through a lot of that and help you with that particular question. That's a great question, by the way. And I do believe you need to journal. I found that by keeping track of what worked and what didn't work, I went back after about 4 or 6 weeks and said, I didn't realize how well that worked versus that worked. And I was just kind of trudging through life, and going back and looking at what I did really helped me quite a bit. Edie has a question. I have bad fibromyalgia flares. What's best for me? Going back, a lot of that fibromyalgia flare is coming from really two things. One is those flares cause a lot of inflammation, and that inflammation causes a lot of pain. I know there's a number of practitioners in my business, cannabis practitioners, that the first thing they do is they reach for THC to be able to answer that. I tend not to do that. I've worked with a couple of what I consider to be the top cannabis practitioners here, not in Florida, but also in California and in Colorado. And what we tend to recommend is products that have a good amount of CBD in it, as well as THC. As you mentioned, the 2-to-1s work very effective for some people. You might use the 1-to-2s, depending on the level of pain that's there. But I would say pay attention to the CBD as well as the THC. You have to have both of those. Now, the real key to managing those flares is to take the product a little bit in the morning, sometimes in the middle of the day, and sometimes at the end of the day. A lot of folks will say, gee, I take it in the morning, it works great, but it's back by the end of the middle of the afternoon. That's because, remember, those tinctures have a 4 to 6 hour range. That means the best you're going to get is a edible that'll last you about 10 to 12 hours. So really pay attention to a regime that uses it a couple times a day. My mother has fibromyalgia, and I recommend that she uses it 3 times a day, and it's really helped her quite a bit. When she does that, it works. When she doesn't do that, guess what? She's in pain. So your body will tell you. You'll be able to figure that out quite a bit. But that's a great question. And like I mentioned, I tend to lean towards the 1-to-1s, 2-to-1s, 1-to-2s. I think you'll find that. Try a little bit of that and see how that works. And then if you get, depending on your tolerance for THC, you may want to add more THC. But in the case of a lot of people I know, they go the other way. And like I mentioned, my wife is using, 9-to-1s, 12-to-1s, rather than 1-to-1s. It really helps her quite a bit. I hope that really answered that question. Now you're going to get another question of where is Insa located. We're going to answer that in just a second. RSO versus other oils. Why doesn't RSO seem to affect me like other syringes and oils? I know it's in its raw form. RSO, by nature, is whole plant. Rick Simpson oil, which is what it stands for, made a product to be able to solve a melanoma problem that he was having. And he found out it worked very well for cancer. And not only it worked very well for pain. I use RSO to be able to manage pain. There are times that I'll do a very heavy workout. And again, I'm a senior citizen. I'm not 20 years old anymore, but may leave me where I have to be able to manage that. And I use an RSO oil exactly for that. Why doesn't it work? Well, it might have to do with the amount that you're taking, but I would say be very careful with RSO because it is very strong. It's out there. Now, there are some RSOs, which is fascinating, that are now on the market that aren't just heavy in THC, they also are heavy in CBD. Look at the CBD to THC ratio in the RSO oil that's out there. When RSO was first made by Rick Simpson, it was leaning heavily towards the THC side. What they found over the years is you can make this with a higher concentration of CBD. So I would say, Jerry, what you're looking for is something that is really addressing your particular condition, and that condition might need more CBD in it. So look at an RSO oil that has more CBD in it than has THC in it. Do you have any comments on that, Lisa?
Yeah, well, everybody has a unique endocannabinoid system. Everyone is starting from a different baseline. And so, the double-edged sword to the cannabis products that you see is there's a lot of them. And so there's a lot of them. And so it might take you a little bit of time to figure out what works best for you, but there's a lot of them. So you have a lot of different options that may actually really jive well with your system. And so, yeah, I completely agree.
Yeah, I'm a huge fan of RSO, I have to tell you. So, Jerry, I hope that answered your question. Take a look at, again, a product. It will probably help you with quite a bit with that. Keith asked a good question, is this, what about RSO? Can you smoke, and how good is it for pain, neck and back? I can tell you RSO is something that works great for pain. Okay, I use it, and I use it for a reason, because it works. Now, you don't smoke it. RSO is an oil. Okay, and so it's really not something, a lot of RSO comes in really 2 different formats. One is in a tincture format, one is in a syringe, and the syringe is like almost a consistency of a tar. Okay, and so a lot of times if you're looking at that type of RSO that comes in a syringe, it's better to put it on a cracker, put it on a piece of chocolate, not an edible, but a canister edible, a piece of chocolate, and it works really, really well in that particular area. Does it help with neck and back? Absolutely. I can tell you it really does. But I have found a couple of RSO tinctures that I use. I stay away from the syringes. They're just too hard for me to use. So call me lazy, but I prefer the tinctures. But RSO tinctures, I found are very good. And again, I don't know of any RSOs that are available in a smokable format. but I do know that are available in tinctures as well as the syringes. But hopefully that'll help quite a bit. And Rick Simpson oil is extremely effective. I have 2 patients that are managing back problems, and I recommend RSO for them, and it's really helped them quite a bit. But again, we've had to go through a whole process of making sure we have the right amount, we've got the dosage correct and things like that, because you're playing with something that, like 151 Bacardi, it has punch to it. The good news is it works. Bad news is it works. Okay, so let's worry about that. Cynthia asked a good question. Do RSOs have soy in them? I'm not familiar with that. Are you familiar with that? I know I've seen it. I've seen it with certain coconut oils and MSO oils and things like that. I've not seen any with soy in it.
I've never seen ones with soy in it either. It's usually just pretty much just the plant material. There's usually very little, if any, additives to it at all.
Yeah, yeah. Clark made a good comment. He said, I was told it depends on how it's made. You can smoke it. Clark, Keith, I am, again, I'm not familiar with smoking RSO. There may be somebody who does, and I'd love to find out if you have a source for that. Please let me know. That's new ground for me. I tend to stay in the area of using it more as a tincture drop that's out there, or basically put it on a cracker and use it as an edible or something like that. Again, I'm just not used to it. And if you have somebody who has that information, please get it to me. That's new. That's a new one in my world. Now we have 3 questions on where is Insa. So let's talk about that, because you're new to Florida. Let's start with your location that's now open. In fact, you're having a grand opening this weekend, right?
We are. We've been open. We've had a little bit of a soft opening here for the last few weeks, but we are celebrating our grand opening, breaking new ground in Florida. This Saturday, the 22nd, we have a lot of events lined up for you. We have a location in Tampa, and we have a location in Clearwater with plans for many more. So
you're being gentle. You're actually going to be opening up almost 20 locations in the next couple months. So
well, I don't know about months, but certainly next year we do plan on opening quite a few. We want to be available to everyone. Florida's a big state. It's not like Massachusetts, where it takes only 3 hours to get from end to end. And so we want to make sure we have a location near everybody in the state. And so, we are open from 8 to 9 every single day. If you want to, double check that address, you can always go to insa.com. And if you want to check out the menu, you can order online. Or if you want to talk to somebody over the phone before you put in an online order, go ahead and call 1-877-500-INSA. We have a customer service, a real person available to talk to you from 7 a.m. to 11 p.m. every single day. And so I am not joking when I say that we're all about education. Those people are there to help you, educate you on the products, or to help you with the ordering process, or even put an order in for you. And so, we have that location in Tampa, and that is where we are having our grand opening celebration. And so if you want to click on to the next slide, we can show them a little bit of what's
I think you're having your grand opening on Saturday. You mentioned one of the specials. You mentioned one of the specials that you have coming up.
Oh, we've got some really good ones. So not only will you be able to join us for just some fun and, some swag, everybody loves some swag. We even actually have some virtual reality headsets. So if you want to see behind the scenes to our grow in our kitchen and our labs, you can come in and pop on the goggles and see what's going on there. But we also have some really great, deals going on. So it's going to be 25% off any purchase for you guys. As well as with any purchase, you're going to get a 1 gram pre-roll for only a penny. And so it doesn't get much cheaper than that. And if you do end up spending more than $100 or $100 or more, we're going to give you a really nice welcome gift. But you're going to have to see what that is. You're going to have to come in to see. I won't tease that too much. But come see us in Tampa. Just to be clear, that is going on at Tampa. All of the VR and the swag giveaways are all happening at Tampa, not at Clearwater. But come see us for those promotions. We'll be happy to let you know what Insa has to offer. We love offering these discounts and these sales to people because a lot of patients are on a budget. And as I mentioned before, cannabis is a journey. And so we want you to be able to try these various products without necessarily, having too big of a hit on your bottom line budget. And so come see us, talk to our, bud tenders, our retail associates. We'll be more than happy to answer any questions you have. And I do want to point out this picture here is a great example of one of the differences in the shopping experience with Insa. So a lot of other dispensaries are very much like, almost like a pharmacy, where you line up, you give them your order, and they go in the back and grab it for you. Here we have a much more interactive way of shopping. You can actually browse at our dispensaries. And so you can take a look at our various products. You can see what they look like. You can even smell them. You can go to our flower bar that you can see in the back there, where you can actually smell the cannabis before you purchase it. We like to say the nose knows. And so, as you've said a few times, Mark, listen to your body, and your body will tell you what you need. And sometimes just by smelling cannabis, seeing what one you are attracted to more than one over the other, just by smell alone, may be telling you something. And so something is just really hitting on that sense. That might be the one for you. And so, the location here that you see is in Clearwater. We have that one in Tampa. And we plan on opening up a whole lot more in the future. But come see us this Saturday. If you, have gotten anything from this, we want you to save some money. So come see us.
Now, we had one question from Anonymous. What's the closest to Palmetto? I think both Clearwater and Tampa are about the closest that you're going to find. That's there. I don't know, for this particular person, this anonymous person, I don't know where they live exactly in Palmetto, but you might want to take it one of those two locations. Now, is Clearwater open yet?
Yes, it is.
Okay, so
yes,
both
it
of
is.
those locations are open.
Yes. My good friend Joel is the manager of the Clearwater location. He's been with us from the start. And so he's got a lot of experience in this industry, and definitely go in there. If you see Joel, tell him Lisa says hi.
Great. And you can see here where you can match up the different routes of administration to a number of the products that are out there. And again, a number of products are waiting for OMMU approval, which are your topicals and your capsules, but will be available soon. And right now, these are the products that are there. I love the fact that you have concentrates, like you have batter and things like that. That makes a big difference.
Yes, those are some of my favorite products personally. I love using concentrates because not only do you get a high potency product, you also get something with a high amount of terpenes as well.
Right.
And I know I'm a little biased, but I got to say that our concentrates are some of the best available on the market. Not only do we focus on high potency, like a lot of manufacturers do, but that high terpene content is something that really makes us special as well. And since we focus on that from the flower stage, our cultivation team is definitely looking to encourage high terpene content. You see that really come through in our concentrates as well.
Now, we had a great question from Dee Dee. Dee Dee, thank you for bringing this up. She said, before purchasing the product, do you still need a certificate to purchase? In other words, I don't know exactly. I think if she's talking about a COA certificate of authenticity, you can provide them and show them what you have in the product. Is that correct?
Yep, we will be able to provide all testing to people. As you mentioned, the testing regulations are very vigorous for a dispensary. And so if you want to see the full sheet of what is available on a product, we can provide that for you.
Right. Now, I think that if you mean a certificate, or do you need a medical marijuana license from here in the state of Florida? The answer is yes. Okay.
Yes.
It's there. But I think you are very open about what's in your product, not just the strains, but also the terpenes, flavonoids, and that type of thing. And I think that's one of the things in meeting you all and working with you, I've really been able to appreciate that's out there. And I'm going to take you up on a concentrate challenge. I'm a concentrate fan. I use them in the evening, so we'll figure out how good they are. I'll challenge you on that one.
Love it. As I like to say, I'm a dabvocate. So definitely try some of our dabs, and I can say you will not be disappointed.
Sure, it's really there. Last thing I want to point out is dosing. Dosing is absolutely critical. And as I mentioned, we did a dosing webinar a couple of weeks ago. Like alcohol and caffeine, everybody's body is different. I mean, I have friends of mine from high school that literally one drink, they'd be done, and another one that could drink forever. I have friends of mine, I lived in Europe for years, and I learned not to drink with Germans and with Brits because I can't carry their bottles. I mean, I'm not even in their league. But as I mentioned, it really depends. Pay attention to your body. Pay attention to go low and go slow. Know what your therapeutic level is for both CBD and THC, and it'll be able to help. And also pay attention to the terpenes that work for you. It's something that will help, help quite a bit. Also, Cynthia asked a great question, and that is, do you have a store near the villages? And the answer is yes, you're opening up a store in the villages.
Coming soon. Yes. We are going to be opening up a store in the villages, hopefully in the next few months here. And so if you want the most up-to-date on our store openings, you can go to insa.com and sign up for our emails, and you'll definitely be let known when we are opening up that location and any other locations in Florida.
Okay, spoiler alert. So I'll be the bad guy. You can throw me under the bus. We're doing a live seminar at the Waterfront Inn in the Villages on November 16th. Cynthia, please join us, okay? And Insa will be there. And yes. I'm not saying this is going to correspond to any grand opening event at all. Okay, I won't even mention that. Okay, but I know that there is a reason why you're doing that in the Villages. So spoiler alert. Okay.
We're excited to be near you.
Yeah. Please join us. Please join us in the Villages. And if you have any friends in the Villages that really want to take a look at medical cannabis, the subject that day is going to be pain management as well as anxiety and stress. So that's something that a lot of folks are trying to manage. So please join us. We have one session in the morning at 9:30 and another session at 1:30. We do that because typically these get booked up. So we want to make sure we're available for folks that are there. So Cynthia, please. It's at the Waterfront Inn. When you ask me where, it's at the Waterfront Inn. And go to Marijuana Aware. If you go click on the page, you'll see the sign-up forms for that. The Waterfront Inn is in Lake Sumter, right by Lake Sumter, in the middle of the Villages that's there. Okay, Lake Sumter Square. So I hope that helps. I do want to mention that if you're looking for CBD products, I do have a store that has CBD products. We're not competing with Insa. What we're doing is we're providing doctor-recommended, doctor-vetted products for CBD. One of the things that I got concerned about was people going to gas stations and buying their CBD product and not getting what's there. We feature SunMed products, and so please feel free to go out there and be able to take advantage of it. It's mybotanicalwellness.com is the store, and use MMWW15 code to get a 15% discount. We hope that helps quite a bit. And I'm going to shamelessly plug the webinars that are coming up. Next week, we're talking about athletes with how they can benefit from CBD and medical marijuana. Plus, when it says know your options, this is the different routes of administration. On November 9th, we're talking about sleep. And then, of course, on the 16th, it's going to be a big day. We're going to be talking about not only having the webinar that's going to be at the Villages, but also we're going to have a webinar that night on sleep that's there. So please come and join us. Bottom line, you're in control. One thing about cannabis is you control what you take and how you take it, how much CBD and THC. You're not going to get addicted. Your body produces its own cannabinoids, so you're not going to overdose. And more importantly, the entourage effect will help you. So I know we've been at this for about an hour and 45 minutes. And thank you, everybody who has hung around for that time. We hope this has been helpful. As I mentioned, my goal is if one person can get their life back and be helped, we feel we'll be successful. And I hope it's more than that. But first of all, thank everybody for sticking around. Lisa, any closing comments?
Oh, just thank you so much for having us. We hope to see you at Insa. And again, if you have any questions, feel free to go to our website or call that number, and we'll be more than happy to walk you through anything that you need. We're here for you. We're here to make your day better. So, right. Thank you so much for having us, Mark. This was a pleasure.
Well, thank you very much. And I want to thank everybody for attending the webinar tonight. I know that this, especially pain management, is something that is just no fun. And we're here to be able to help. I do want to thank you for the audience for being here and hanging in there. There's a couple other people in the background that do really all the hard work, which is Lee and Leah. Thank you very much for the help. And I'm going to give a special shout out for the person who actually made all this happen or came up with the idea, Alyssa Katera. Alyssa came up with this idea about almost 3-4 years ago, and really was the emphasis behind this whole webinar series happening. So thank you very much. Please join us next week. Hopefully we can talk about athletes, but more importantly, for those of you from the villages, please join us November 16th at the Village Waterfront Inn. Go to marijuanaaware.com and you can sign up. Please do that and tell your friends. Hopefully we can see you that's there. And again, thank you very much. Lisa, have a good evening. You're going to be doing the webinar with us next week, right?
I will. I hope to see a lot of you guys there. Thanks
Good.
so much.
Good. And thank everybody for the great questions. Have a good weekend, and please, everybody, stay safe.